tell us a bit about yourself and what is your current profession? Actually, what is an ophthalmologist, if I'm pronouncing it correctly?
Yeah, so it's pronounced as a ophthalmologist.
Oh,
Yeah, so
ophthalmologist.
yeah, ophthalmologist.
Okay.
Yeah, so basically that's a eye doctor lah. Yeah, I'm technically not the ophthalmologist yet. I'm still a registrar, but I'm working with the government hospital in Hospital Selayang, providing eye care for patients in the government sector. Yeah, so my background experiences, I actually graduated from Moscow, Russia. Yep, and then I did my housemanship in Hospital Kuala Lumpur for 2 years, and then moved on to Malacca to serve there. Interestingly enough, in the emergency department, so I'm pretty well versed with that scene as well. And then after that, I moved on to do my specialist training in ophthalmology. And then here I am. Yeah, I've transferred around a few different hospitals providing ophthalmology in Klang Valley, Sungai Buloh, Serdang, and yeah, now I'm in Selayang.
Now,
So yeah,
when you say ophthalmology,
yeah,
right? Another term comes to my mind is
yeah,
optometrist.
yep.
So what is the difference between these two? And
Okay, so ophthalmologist is a doctor. Optometrist is actually a person that a profession that actually checks people's vision. So it actually we work very closely. Basically, we work hand in hand. And in certain countries, the scope for optometrists is quite large. Like they can actually do basic monitoring and also diagnose cases. They are not allowed to prescribe and also do surgeries, of course, but they work really well together, and I mean that's our core like partnership with each other.
mm.
Yeah,
Obviously, the topic that we're going to talk about tonight is quite sensitive.
yep,
There are some areas which we will definitely address in
yep.
order to hopefully educate the audience about what's really going on with the healthcare sector and how is it actually like, being a doctor working in this industry lah. If there is one sentence that you can describe its current state lah, what would
Yep.
it be?
I think at its point right now, it's dire, but very salvageable. I think it's really salvageable. So that is my key takeaway at how I actually feel about the system. Being inside the system itself, I mean, I see from a day-to-day basis of what is going on in terms of like patient healthcare, the people who actually need healthcare has significantly evolved over the years. And now with the recent history of, I mean, the recent news about the insurance tariff rises, it sounds like it's all doom and gloom, but I think that we are at a very important pivotal point to make things better. And I think that is how I would like to keep my perspective a bit on the optimistic side. And yes, it does make me sound like that, but I feel that that's the only choice that we have, right? We can't give up on this system.
So it's fair to say it's sort of like a sinking ship lah, and it will sink if we don't do
Continue
anything.
this route. Yes, if we continue
Yeah,
this route, yes, it will sink for sure.
yeah.
But there are things that we can do. Yeah,
Mm,
there are things
mm.
that we can do.
Not so sure whether you saw Dr. Tim joining in.
Yes, I
Dr.
did.
Tim is here.
Yes.
Yeah,
He's
hi
a
Dr.
good.
Tim. Yeah,
I,
glad to have you here as well.
yeah,
Actually,
I think he'll be a very good.
I'll be doing another interview with Dr. Tim as well. So it'll be interesting. Yeah,
He'll be a very good speaker to be on this channel as well. I think that he has
yeah.
very good insights on this matter. Definitely.
Now, Dr. John,
Yep.
you mentioned just now that we are in a dire state. How
Yep.
do you think we got here? And specifically, when you say dire, right? What do you mean by dire? Yeah.
Okay, so basically right now, okay, okay, what is your impression of Malaysian healthcare? Like what do you think about it?
Well, I'm generally healthy lah, and I have touch wood,
Yep.
okay, touch wood. I've never been to a hospital for any emergencies before.
Yep.
But based on my research so far, I
Yep.
think Malaysia's healthcare, like what you said, like it's probably a sinking ship. In fact, I was a bit more negative than you. I think it's like going down the drain very rapidly,
Okay,
right?
okay, all right,
Because I
all
was
right.
looking at insurance premiums and stuff like
Yeah,
that. We also talked about it in WhatsApp, and
yep,
which we also bring up later, right?
yep,
You mentioned that bankers, accountants, right?
yep,
They are the ones that are seeking treatment at public hospitals. When
yep,
10, 20 years ago, you started working in this industry,
yep.
only the true B40s were seeking healthcare at public hospitals, right? So my
Yep.
impression is that, well, it's bad.
Yes. I mean, Yeah, okay.
Yeah.
But in terms of like, so you said that you were relatively healthy, but then you have family members as well that actually go to the hospital, and I mean, I'm sure you know friends that go to the hospital as well. So I would say that our system is actually very, very unique. I mean, Malaysia is quite blessed in a way that we technically get free healthcare. Yes, you can't pay for insurance today, but can you still see a doctor? Definitely, yes. You know, you can pay $1, go to a clinic kesihatan, pay $15 for a specialist consultation in a specialist consultation in a tertiary hospital, you know. So that's minimal cost to most people, and most people can actually afford that, right? So we have this backup system of like a governmental healthcare service that is actually like supporting most of the load of the patients. Then we have the option of private healthcare, which is uh, a very good thing as well, because if you want faster healthcare, you want maybe the most technologically advanced things, you can go to private healthcare. So there is an option for people. And that's why I think that that's the beauty about Malaysian healthcare, that actually most people overlook, right?
Mm.
Like we were talking about this a while back, that if you get sick in the United States, right? If you get a heart attack in the United States, just calling the ambulance and asking the ambulance to come, the first question they'll ask you is, do you have insurance? Are you covered by insurance? And if you're not covered by insurance, you either fork out money yourself, which will cost up to about 300 to 1,000 US dollars just for the ambulance pickup, not even considering treatment yet, just the ambulance pickup. And then your second option is just to probably just die on your bed.
So,
You know, that's the
so
option.
just to be clear, sorry for
Yeah,
interrupting you there. In the
yeah,
US,
yeah,
the system is so broken that
yeah,
if someone gets a heart attack, to the state that it's an emergency, this person's life is at stake.
yeah.
If they don't pay that 300 to 1,400 US dollars,
Yeah.
you're saying that the ambulance won't come.
Yes, it will come. Yeah.
Oh my
They will,
God.
yeah.
Oh
I'm not
God.
sure whether they have schemes where you can, like put like a depot, like a pawn shop or something like that, where you can, barter some of your assets or something like that. But yeah, that's actually the true reality. It is the harsh reality actually.
Wow.
So that's one of the reasons why I feel that the Malaysian healthcare system is actually pretty good in that sense. However, the big
Caveat.
quotes that I have to say, yeah, the big caveat that I have to say is that Malaysians actually take healthcare for granted.
Oh,
Really, they take it for granted.
okay.
Yeah.
Okay.
It's because we pay so little and healthcare is so accessible by a lot of people. I mean, everybody technically, that we take it for granted. We think that it's a given thing, we think that it's a given thing. So, like, okay, just let me throw this question back to you. Like, do you think that healthcare is a universal right? Do you think it
I
should be universal?
definitely.
Okay. Right?
I
You
think
it's
this should be a
right?
universal right for everyone.
Correct,
Yeah.
correct.
Mm.
But so that's the thing. If it is a universal right, we need to put a lot of measures to make it this way. So it took a lot of effort, like us taking this system from
Right.
the UK, when they came
Right.
over, they gave it to us. Of course, not the best, not placed together in the most appropriate manner, but we patched it together and we made it work till today. So I would say that yes, I agree with you that healthcare should be a universal right, definitely. However, if you think about our governmental spending on healthcare itself, it's only like 4 to 5% of GDP. So you're expecting a human right, but you're only willing to pay like 4% of like what you have for this. We will cover more about this, like the finance stuff about around this thing, maybe a bit later. But just I want to like highlight to like maybe the listeners and stuff like that, don't take healthcare for granted, man. Like it's actually something that you don't know you need now because you're healthy, right? You're healthy now,
Yeah.
but in the future you will.
Now recently, okay, actually just yesterday and today, there
Yeah.
was a huge hoo-ha about Prudential raising prices and stuff like that. You guys can see the drama on my profile, on our profile. Okay, it's a
Big
heated
trouble.
exchange. I
Yeah.
would say it's a heated exchange between us and the citizens as well as the insurance agents.
Right.
So now Prudential themselves said that they had to increase prices because there's an increased number of claims.
Yeah. Yeah.
Are we trying to say that Malaysians, in a way, when you're talking about us taking healthcare for granted,
Yeah.
right? Is there a case where citizens misuse their insurance policies, where they can seek treatment at public hospitals, but they choose to go to private hospitals. They choose to seek treatment at private healthcare centers, therefore, causing this price increase at a certain level. What do you think?
I mean, to me, it's actually kind of fair. Like, if I paid for private insurance, obviously, I would definitely want to go to a private hospital if it's already covered, right? Because
Right.
I've
Yeah.
spent my money to come to this, right?
Yeah.
So in terms of whether they abuse claims, because this is actually one of the factors that was touted as the cause of like medical tariffs, insurance tariffs rise by like Khazanah. And what they said is like this buffet table syndrome,
Yes.
right? They call it a buffet
Yes.
syndrome.
Yes. Yeah.
So basically, they're just claiming unnecessarily just because of they have paid for the insurance. For me, I personally can't really tell you for a fact that this is happening. From the research I've done, I've heard that this has happened in certain places, and especially during times where there was what do you call that, a hospitalization allowance. When patients were paid when they were hospitalized. So there were people abusing this particular system. However, from what I'm aware of right now, there is not much of these policies being given by insurers anymore. So in terms of like how much claims would make to the large amount of pie, I'm not too sure. But yeah, I would say that there would definitely be bad apples in this situation. Like there'll be bad players in this situation.
Yeah, but then it's
No.
the insurance companies say like that's the main cause
Yep.
of the increase. Which if we could have some numbers up, I will definitely post it to
Yep.
you guys. But
Yep.
but on topic which is the title of today's session.
Yep.
The biggest question of all, are doctors burned out? What do you think?
Generally, I think that most doctors. So when you talk about doctors, actually there are a lot of. It's not so simple. It's a bit more nuanced. Like there are actually main categories of doctors. So you have doctors in the government sector, you have doctors in the private sector as specialists, and then after that you have the GPs. So like these are like the big trees, I would say. Of course, there are other subspecialties and etc. If you talk about whether doctors are burnt out, generally in the government sector, a lot of them feel so. However, in the private sector as a private specialist, people don't feel as burnt out. But in the GP sector, surprisingly enough, there is, even though you call them like private doctors, where a lot of people would just throw them in the same category as a private specialist, but they are burnt out as well. A lot of GPs are closing outside. Yeah.
Now, burnt out. What is the reason behind this? You probably when the pay itself, right, of doctors working in the public hospital, how does it compare to doctors working in a private hospital?
It's a big difference. Definitely, there's a big difference.
Is there like a percentage, like 50% more? Or?
I think there was a video by like the this Malaysian pay gap. I think there's a channel, you know about that. Have you heard of that channel?
Yes.
It just goes around interview. Yeah. So basically, from that video, we can see that it's easily like a 3 to 4x increase, depending on your specialty, definitely. Not all specialties are equal. That's why it's very hard for me to answer this particular question, because yes, there are certain specialties that actually do a lot better, but there are some specialties that maybe do just marginally better than government specialists.
But it's safe to say that it's much more better paid, lah. Yeah.
I mean, the reason why I would say that is because the wages that a lot of the government doctors are having is insufficient to cover current rise of cost of living. I think
Dr. Tim also mentioned just now. Thanks, Dr. Tim, for commenting. He said that 7 to 8 times.
Yeah. So that specialty, yes.
Oh
yes,
my God.
Yeah.
Wow.
So definitely, I'm trying to be a bit more politically correct here, but yeah, it's actually true that definitely there's an increase, but I don't want to focus on money being the major driver of like burnout, because some people, I would say that a lot of doctors that I've worked with, and I mean, you might ask this question. I mean, I'm not sure if you asked this question before. If the money is so good, why aren't they all doctors just going to private? Why are they
that's the question.
Yeah, why do you think
that's actually that's a good question,
Yeah, right.
Yeah.
So I mean, understanding that actually there are people who don't work for money. I mean, they work for money that's enough.
Right.
That they're happy with.
Money is
right?
their second priority, right? The first
Correct.
priority comes patient's healthcare, right? Yeah.
Correct. Yeah. So they either enjoy healthcare to a certain level which they are comfortable with, and they think that the remuneration that they are getting is fair
Right.
enough, right? So then they would choose to stay. So if that is the case, then they should not feel burnt at all. But they still do feel burnt for sure, you know. And one of the major reasons obviously is because of the underappreciation that the doctors get in general, you know, in especially in government service. If you look at the headlines, it's always some doctor in KKM did something wrong. But have
Yeah.
you ever read about some doctor in KKM doing something right? You know what I mean? Like when is the last time that you read like KKM doctor did like some save like some patient's life of or something like that? You know,
The
you don't
only thing that I
really
can think of is recently there was this KKM thing which went viral. A lot of doctors posted hashtag leaving KKM or stuff like that, you know.
already
Yeah.
been done. So
Yeah.
you see, bad news,
It's
right?
bad
It's
news, yeah.
never good news, right? Never good
Yeah.
news. Always bad news. So that's also one point that I would like to say. You know, it's like the underappreciation that doctors have, especially after COVID. I think like after COVID, I mean there was a big herald for doctors for a short period of time, and then after that it just fizzled out, and you know like people didn't understand that like it was like these people who were working that were trying to save lives during that period of time. And after that, just to be met by like public complaints, you know, of like, oh, this doctor did this doctor did that, you know. Recently there was like a influencer that said like a trainee doctor like drilled something into the child's leg and then the child had to die. You know, it's always this kind of sensational bad news that comes
Mm.
out for KKM. But to be honest, every day we save lives, like why
Yeah.
nobody writes about that?
Yeah.
Nobody says anything about that, right? Yeah.
No,
So
that's why I feel that it's crucial that we do a session like
yeah,
this today to
yeah,
yeah.
yeah, definitely, definitely. I think that's important to educate people regarding that, for sure. Yeah.
Now now let's move on over to consultation fees lah. Okay.
Okay.
Because
Yeah.
previously there was a post by I forgot which influencer already saying that doctors actually charge people who are insured more
Okay.
than those people who are not insured,
Okay.
which at the end of the day leads to people saying that, hey, why are doctors charging people who are insured more when the price is supposed to be much lower for this consultation fee? Do you mind elaborating on that?
Yeah. So, firstly, this is talking about insurance claims, right? We're
Yeah,
talking about insurance claims.
yeah.
Okay. And it's a hospital bill, I presume.
It's a hospital bill, yeah.
So then again, like I said, always the easiest person to point the finger to is always a doctor.
Yeah,
It's never
that's true,
going to
right?
be, it's never going to be a big hospital, or it's never going to be a big insurance company, because multi-billion-dollar companies. This doctor, what, 50,000, 100,000 a month, or 50, say 50,000 a month. It's like, yeah, this guy definitely has to take the blame. He's making 50,000 a month. You know what I mean? So it's very easy to point fingers at doctors. But if you look at overall, I'm not sure if you have seen any overall bills. I actually have an example actually. So this bill that I'm reading from is from maybe it's actually an insurance claim bill. This dude posted it online, and looking at the charge for surgery, right? It's a cholecystectomy. Basically, they remove the gallbladder, and it came up to about 14,000, right? 14,000. That was the claim.
14,000. My God.
1,400, yeah,
Wow.
1,400. And the doctor take home was about 4,700 from the 14,000. Yep.
Okay.
And this is two doctors. So there were two doctors sharing the bill of 4,700 something. One of them was an anesthesiologist, so that's the doctor that puts you to sleep. So usually, because they are not the one performing the surgery, of course they get a little bit lower. So, but the main doctor gets 2,700, yeah. So that's the breakdown from the 14,000. 30% around there goes to the doctor, and the rest goes to other charges, miscellaneous charges,
Wow.
of course.
Wow.
So yeah, so you were asking about whether the doctor gives a different charge for patients with insurance or not. I can't verify for sure. There are discounts that some people would give for sure, like to either people who maybe cannot afford it. There are some doctors that will pay out of their own pocket. But
Wow. Okay.
what they can do is just adjust their consultation fee. You know what I mean? What they can do is just adjust what they are limited to. So if you talk about like what I can control. Let's say, for example, if I do a surgery, I only can control my consultation fee. So I say, okay, Shinji, I think that you're from a really tough background and I connected well with you. Yeah, let me waive my consultation fee. Okay, $300 off the table. But the bill is still 14,000, right? Like, I mean,
Wow.
it's marginal, you know what I mean?
Uh,
Yeah. I did hear a recent post on DFM as well regarding some people having discounts up to 2 times. I can't really verify this information, but of course, maybe if there are any insurance agents in the chat that might want to weigh in on this thing,
yeah, definitely
feel
lah.
free to. Yeah.
Just now we talked about a bit regarding insurance. I want to talk about private hospitals, like even though you're working at a public
Yep.
hospital. As far as I
Yeah.
know, doctors' consultation fees and examinations, whatever that's conducted by the doctor,
Yep.
correct me if I'm wrong, these
Yep.
are heavily regulated and capped.
Yes. Yeah.
Whereas the other fees, the hospital charges from
Yep.
private hospital,
Yep.
which make up 70%
Yep.
of a patient's bill,
Yep.
those are not regulated.
Yes, to a certain
So
degree.
essentially, what we're trying to say here is that the private hospital itself can easily charge 35 to 40 ringgit for a pair of gloves. Are we
Yep.
trying to say that?
Yeah, you can. I mean, it's up to you. If your
Wow.
gloves is like LV, yeah, probably get just 45.
Wow.
Yes,
Wow.
that's true. That is true. It's up to their discretion for sure.
And is it fair to say that this is one of the reasons towards the increase in medical premiums that we're seeing?
It's actually okay. Yeah, I mean, I wouldn't straight up deny that that is one of the reasons why the healthcare cost has gone up. I wouldn't go to all the way to say that that's the reason why the entire insurance premiums are increasing, because I think it's a lot more complicated than that. But that is one of the reasons why the costs have been increasing. As you know, there are a lot of new hospitals being built over the Klang Valley and also the prominent states. So everybody is trying to become more and more luxurious than the other. Everybody is trying to provide care that is more comfortable for the patients, right? You don't want to go into a 70-year-old hospital. You want to go to something which is state of the art, right? So all these companies that are building hospitals, obviously, as you understand, they are businesses,
Yeah.
right? They have to make a profit, and the way that they can profit back from there is basically, okay, I give you something premium, then your price is going to be premium as well, right? I mean, it sounds fair, in a way, it does sound fair. Whether it's going to drive the whole system into the ground, possibly as well. But yeah, it's a business essentially, right?
It's basically a for-profit business,
That's right. Yeah, it is for-profit business. Yeah,
private companies, this stuff. I think this is the thing that citizens probably have to understand, and it's a hard pill to swallow.
yeah, it is.
That insurance companies and private hospitals, they are for-profit businesses.
Yeah,
Now, in my opinion, which I'll get it from you shortly,
yeah,
I have no problem on healthcare being a for-profit business. But
yeah.
to me,
Yep.
I think there must be some ethics involved. It must be ethical.
Agree.
Don't just increase prices just because you can, right?
Agree.
Because I believe that even though they increase the prices by so much, the medical insurance premiums, right? Did
Yep.
doctors' fees actually increase?
No. Because we are regulated, right?
Wow.
We are regulated. Yeah. Doctors' fees don't increase. Yeah. But the entire pie does, move up essentially.
Wait. So doctors' fees right now, let's say, today this person goes into a private hospital and consults a doctor. What is the
Yeah.
fee like? What is the fee like?
It's up to, if I'm not mistaken, it's about 290, if I'm not mistaken. Yeah, this one, it depends on the type of doctor that you see, definitely. So, okay, let's go from the lowest, right?
Right.
So lowest would be like general practitioners. They're capped
Sure.
at about 10 to 35 ringgit consultation.
And how long?
How long? What do you mean by how long? How long the consultation?
Yeah.
How long? But probably there's no limit to the duration of the consultation,
Wow.
but yeah, that's the cost that they can charge, right? And that's why a lot of general practitioners nowadays are being so vocal about it. They are talking about like that this price has been stated since 1992, somewhere around there. It has not increased, and they are calling for a push for increment. Yeah, then that will get backlash by the what do you call that? The patients. They'll be asking like,
Why?
"Hey, dude, why are you increasing?" Yeah, but in actual fact, if you go and get a haircut nowadays, if you go to a decent barber, you also know it's gonna cost you about 40 ringgit, 30, 40 ringgit. Yeah,
Mine is
and
60. Crazy.
yeah,
Yeah.
yeah. So how often do you cut your hair? Once a month? Twice a month? Maybe
Oh,
once in 2 months?
what? Oi, twice a month, I got no more hair left. Oi. My hair is going to
Yeah,
be much shorter than yours already. Actually, your hair length and my hair length pretty much the same.
pretty much. Yeah, pretty much the same. But like, let's say, for example, if I cut my hair like once in 2 months, right? I see a doctor maybe once a year or twice, maybe twice a
Sometimes,
year if I get sick.
sometimes 1 year you don't even see
You
a
don't even
doctor,
see a
unless
doctor.
because
Yeah,
because
correct.
some people are not even going for medical checkups.
Correct. But these poor fellas are stuck with a consultation fee of less than a hairdresser. And the hairdresser makes
Oh,
recurring income every month. You know, these dudes, I mean, really, I have a soft spot for them because I have family members that were general practitioners in their own clinics as well. So it's not easy. It's not such like a fairy tale, you know what I mean? Like once upon a time people say that, oh, if you become a doctor, oh, you make a lot of money, blah blah blah. Trust me, it's not as straightforward as that. It's definitely not as straightforward as that.
so you were saying just now that the doctor's fees since 1992
Yep.
hasn't
From
moved a single cent at all.
yeah, pretty much. I mean, the regulation is around there. Yeah,
Wow. I
yeah,
mean, you can just go back 1992 and
yeah,
look at the prices. Lah. Prices
yeah.
then were like way, way
Yeah.
lower.
Yeah.
Yeah.
So if you talk about what they're trying to do right now is they're trying to do a price display for medication, and the reason why a lot of doctors are going against it is because if that's the only place that I can make my margins from, then obviously you're trying to cut off my last life support. You got to be fair to them. I mean, essentially they're just trying to make a living as well and by providing care. Yeah. So that's something which I feel that the public also needs to kind of like understand and have a bit of sympathy, for the people who are trying to take care of your health. I'm not saying that everybody is a good doctor and deserves to be paid like thousands and thousands a month, but at least give them something which they can be happy with, and be happy with their work at least. Yeah.
Yeah, give them at least a fair compensation for whatever
Yeah.
they are doing, lah,
Yeah.
considering the
Exactly.
sacrifice and the risk that they are taking, right?
Yeah.
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 Now there is an article that surfaced recently
Yeah.
by I forgot which source already, but quite a few
Yeah.
articles are stating that doctors, healthcare workers, healthcare professionals, they are leaving Malaysia for other countries,
Yeah. Yeah.
i.e. Singapore,
Yeah.
okay, our
Yeah.
closest
Yeah.
neighbor. Uh,
Yeah.
and why do you think this is happening? Is pay
This,
only the factor? I think
this,
pay is the
this,
main factor, right?
this topic, Timothy is going to be the best person to talk to you about. But yeah, okay, let me give you my opinion, okay? So to be fair, this is another example of when doctors do something, suddenly everybody, pays attention to it, lah, right? So, uh, every in every segment of Malaysia, every profession in Malaysia, there are people moving to Singapore, right? It's fair to say that, right? Yeah, and leaving Singapore, they're leaving for Singapore. There are a multitude of reasons. Maybe family, they prefer work-life balance there. Remuneration is definitely one of the thing, but I wouldn't say that's the only thing that's the driving factor for that. Yeah, maybe treatment from like how the trainings are being conducted over here, the pathways to specialization is a bit more iffy over here, but I wouldn't say that, like money is the only reason that people are leaving. And that being said, also there are a lot of doctors that come back from overseas as well. From the UK. Like from different countries, they also come here. I mean, I personally also have family members that came back, just to work back in Malaysia. So I wouldn't say that
Mm.
it's like it's a direct one-way exit, though the numbers are pretty terrifying right now. But yeah, later on we can talk about like how do we stop this? Like how do I feel is the main problem of why this is happening. Of course, remuneration plays a big chunk, big pie. And I think if we can solve that problem, then maybe the outflow will be much less. Hopefully, because this is not for you now, it's for you 30 years or 40 years from now,
Yeah.
You should be worried. Everybody should be worried if this happens too much.
Yeah. If we continue going down this road,
Yeah.
right? The current, like what you mentioned at the start of the session, it's in a dire state.
Yeah.
Let's say nothing's being done and we let this can just continue rolling down the road.
Yeah.
Where do you think Malaysia's healthcare sector will end up in 10 to 15 years?
Yeah, this is actually the dire part of what I was worried about, because I feel that when I look at my patients today, I feel that we need to do something for them in the future. Some of my younger patients, when I look at them and like their parents, they're going to suffer this in the future. This is talking about the government sector, right? This is talking about the government sector. Like I've mentioned to you, when I just started working like 10 years ago, most of my patients were clearly B40, right? They're clearly B40.
Right.
And today, like I've treated, ex bankers, high-ranking bankers, accountants, all because of them being unable to afford insurances at the later stages of their life, or they felt that it wasn't cost effective for them, right? It wasn't cost effective for them. And it's very sad to say that if we continue down this trajectory, and we don't do something about this, the people that have been working their whole life to pay taxes are unable to receive proper healthcare during the times of need, which is in the older, in the age group,
Pretty much like the US then.
Yes, yeah. So it's not only like for everybody's to blame here. It's not. I'm not talking about just the government sectors or the private sector. But if you look at private sectors, how much does the insurance cost when you're like 70, 80 years old? Almost about a few thousand a month, few thousand a month. And yeah, so I mean, this is from my personal family members who are paying, right? I know maybe there are insurance agents there that might shoot me with better plans. I'm not sure, but if you are, hit me up. But if not, the plans that I've seen are quite expensive.
1,000
right?
to 2,000 ringgit per month, you mentioned.
Yeah. So in that scenario, you have been paying like insurances from like what?
Since you're 25?
25, right? 25 years old, you've been paying all the way, and then when you're like 70 something, you decided that this is just not cost effective for me. So you stop paying. So now what you do is you have no more private insurance, right? So you have to go to the government healthcare. And then in the government healthcare, because of the number of the shortages of doctors, or the system is not being upheld effectively, then you also don't get healthcare there. So it's a very dire situation. This is the part where I mentioned that.
And I sort of like can relate to citizens when they say that, because the recent post that I posted out on Instagram, one person said that we were told to buy insurance when we were younger, right?
Yeah.
And there was also an article saying that this ex-cancer patient, I actually sent it to you the other day, right?
Yeah.
Not even ex-cancer patient, a patient recovering from cancer, afraid of relapse, 55 years old, right?
Yeah.
Has never made a single claim, bought insurance for 15 years, and suddenly his premiums in 2024 to 2025 jumped 147% to about 2,000 ringgit per year. Now this is cheap compared to the monthly premiums that you're saying about just now, 1,000 to 2,000 ringgit per month. And I'm assuming 1,000 to 2,000 ringgit per month, those type of coverage, right, easily goes above 1 million ringgit one. Right? That sort of annual coverage, right? So, when Malaysians say that they are trying to claim insurance as much as possible, I also sort of get them, because they've been paying out of their pockets every month. And now the company is trying to tell them that don't claim so much. If you claim so much, the prices will increase.
That's right.
So it's like a very toxic loop. Everybody is trying to pass the blame to each other. And at the end of the day, I feel that the people who suffers the most are the people that are paying out of their pockets,
Yeah.
right? Like the
That's
day I
right.
read the article about this patient who's recovering from cancer, my heart just dropped.
Yeah.
I cannot understand why this guy's insurance gets relapsed because he's just unable to pay,
Yeah.
this amount of increase.
Yeah.
And if we go down the road, I think we pretty much be like the US now, right?
Yeah,
Yeah.
yeah, that is actually quite true. But to play devil's advocate here,
Yeah.
lah, right? So from what I understand from the healthcare inflation, right? So
Yeah.
this is something which I also like to kind of like maybe open people's eyes regarding this a bit, lah, right? So everybody talks about the inflation rate, right? Or
Yes.
like the percentages of the inflation. But do people look at what is the amount that we spend? So it's only the inflation rate is only relevant to the amount that you spend. Say, for example, so let's just give you some data. This data is from World Bank, right? Unfortunately, the data only goes to 2021. But look at, so Singapore's health expenditure per capita per year, right? In 2021 was about $3,969 US dollars.
Mm.
Places like USA is about 12,000 US dollars per year. UK about 5,000 US dollars per year. Australia $7,000 per year. You know how much is Malaysia?
How much?
487 US dollars per year.
That is low.
Yes,
Very low.
exactly. So that's what I'm trying to say is that the reason why the healthcare inflation is on the higher side could possibly be due to the fact where we're actually not spending a lot in terms of a global scale, right? So from World Bank data also, it shows that for high, I don't know whether this is too much of a boast, but middle to high income countries, which I assume we are in, okay, they are supposed to spend somewhere around 871 US dollars per year. We are at 487. So this is something which I think a lot of people have brushed across or they have never talked about it much. Yeah. So why this is the issue is actually because healthcare is very, very, very interesting because it's very complicated as well. If you look at it, the equipment that we use to do surgeries on, where does it come from? Do we produce it locally?
No,
No, right? Yeah,
I
we
don't
don't
think so,
produce
right?
it locally. Yeah, we don't produce it locally. We buy from America, we buy from Germany, we buy from everywhere in the world, right? We buy these equipments. Hence, this actually adds on to the cost. You understand what I mean? So this adds on to the cost. They might pay like maybe 100,000 for a machine in terms of US dollars, but we are paying like 400,000 ringgit. You know what I mean, for
Yeah.
that particular machine. Yeah. So obviously it costs more to us. And if we are in a progress of like trying to improve our healthcare, means that we want the best machine, right? I mean, if I were to ask you if you will need surgery one day or your parents will need surgery one day, and if I were to ask you, of course you will want the better machine, right? You wouldn't say, oh no, I just give me the cheaper one and it's cheaper. You know what I mean? Nobody
Yeah.
would actually say that. Everybody wants like more advanced technology because technology has been advancing, right? So hence there should be an increase in terms of like the expenditure that is for us, The expenditure should increase at a certain rate. So what I want to highlight is just that our percentages, yes, inflation percentages, yes, agreeably among Southeast Asia is a bit on the higher side. It is on the higher side, but in our total spend, we have been spending less. So when healthcare expenditure goes up, there can only be two main drivers. One is that the technology is okay, maybe three. Yeah, so three main factors. One, technology is increasing. Second, the people are getting more and more sick. Or third is like the insurance claims are or like the whole system is collapsing. So that's what we see like maybe in the States because it's UK, which has a quite good healthcare system, or Australia is only like 5,000 to 7,000 US dollars per year, but US is like 12,000 per year. And this is 2021. This is pre-COVID time. It's expected to be a lot higher after that, definitely. Yeah. So if you look at the numbers, we are still in the lower end of the spectrum.
There is an under allocation of, I would say, our national funds or our budget onto the healthcare sector.
Yeah.
At least that's what I got from what you covered just now. Yeah.
This is actually not only the national part. This is actually per capita. So basically, it's inclusive of private and governmental. Everything looked into one. Yeah.
Right. Now let's pivot to the consumer. Okay. Let's focus on on solutions. Okay.
Right.
What is something that you hope that Malaysians will that you want Malaysians to hear in terms of healthcare, that you want them to hopefully change, whether it's a perspective, whether it's a thing that they can do today, in order to help them better the current situation for themselves? Because we know uh, trying to move big corporate companies is very difficult.
Yep.
Trying to get whatever you propose up to the government or whatever, it's very difficult.
Okay.
But what's at least something that the listeners here today can take back home and say that, okay, I better start changing what I'm doing, or at least try and improving my current situation?
Okay. So for a start, I think one of the policies or things that I wish would change in Malaysia is to adopt something called like a national insurance policy. So the insurance policy is going to be heralded by the government itself, something like Singapore actually. And all the hospitals will be pseudo like privatized, in a crude way to say, all the hospitals manage their own funds and is able to hire doctors, buy equipment with the funds that they get. How do they get their funds? Itemizing everything that the patients come in for. After that, claim the bulk of things from the governmental insurance, So it's not very far-fetched. Singapore has done it. It seems to be working for them. Everybody in Singapore is covered, regardless of whether you can pay for the insurance or not. There are ways of how we can circumvent like people who are unable to pay, but by ensuring that everybody pays a certain amount for a national healthcare, number one, you can increase funding for the hospitals. Number two, doctors in those hospitals can be remunerated at a competitive rate. This is coming back to how I think we can solve this issue, right? Everybody gets to have a bigger chunk of the pie. And on top of that, the biggest thing that I think is, this is a little bit on the psychology aspect of things, but I feel that if people don't pay for things, they're not going to appreciate it in a certain way. So by ensuring that everybody kind of pays just a nominal amount, this one has to be discussed and looked at, but by everybody paying for their healthcare, it ensures that they're not going to take things for granted. They're not going to
That's
take
so
the
true.
healthcare
That's so
situation for
true.
granted. Yeah. So I
Yeah.
think that this is one of the ways. There are a lot of people who have actually talked about this particular thing. There was a recent viral video by Idris Jala also, and then he talked about this national insurance policy. I think that's something which has to be looked at. However, I think that it's very, very difficult to be the person who voices out to the Malaysian public that, hey guys, you guys got to pay like 50 ringgit or 100 ringgit per month.
Yeah.
Extra, yeah, for something that was initially free.
Yeah. Yeah.
So
Something that you initially need to just pay 1 ringgit.
yes, correct.
Yeah,
Yeah,
right.
so that's why it's a bit difficult for that to be implemented. However, if you don't take steps towards that, it's gonna be a bit downhill from there. Yeah, what we want to do is we want to strengthen the governmental service, because I truly believe in the governmental service, and I think that if you can strengthen it to a level which is like, say, 70% of what a private hospital can achieve, then all of a sudden, the people who want to go and buy private insurance or want to go into private hospitals drop significantly, you know?
Mm.
And that will become a check and balance towards the private hospitals itself, because the private hospital knows that, okay, this guy is providing 70% of what I can provide, because everything is upgraded regularly. The hospital has enough funds to manage itself, manage its personnel, and the quality is almost as good as us. So a lot of people will choose to go to the government healthcare service, right?
Mm.
Yeah. Everything
And then at the end of
should
the day,
be
the private hospitals will look at it and says that we have to lower our prices. Right?
correct. Then insurance claims can come down. So what I'm trying to say that it's not as simple as just one person is the problem. You can't
Yeah.
just blame like, oh, private hospitals are the problem. Oh no, doctors are the problem. Oh no, insurance people are the problem. It's not as simple as that. Everything is kind of linked to each other. But that's the beauty of a free market, right? Because a free market enables things to be self-resolve itself, over a period of time.
Yeah,
Right?
hopefully this will get proposed in the future lah. Something interesting is basically like a non-profit government insurance that covers everybody lah.
Correct.
And something like when you contribute to EPF, nobody complains,
Correct.
right? So why not
Yes.
introduce something that takes a percentage of your salary, 1, 2, 5%,
Exactly.
right?
You get
And
yeah.
every month it goes into a fund where it's used to subsidize doctors, subsidize public hospitals, so
Correct. Yeah.
that the doctors' fees at least get to increase since 1992.
Yeah. Yeah.
Yeah.
It's not about like remunerating the doctors, but it's ensuring that all the hospitals get updated all the time. They have enough funds. The major problem that we have right now is there's not enough funds. Like we don't have enough funds to sustain what we are doing right now. Yeah, and that's the dire part. It's like it's not sustainable because no money. There's just no money. So we also cannot be like, hey, government, increase the healthcare percentages, because a lot of people make noise on that. But when
Yeah.
we tell each and every individual that you have to take charge of your health, this is the insurance price that you have to pay. Either you or the employer, has to pay for this. And like as if what you said, an EPF contribution, then everybody should not complain to that big of amount if they really care, if they really care. Yeah.
Now, with your expertise in the medical industry,
Yeah.
what is the advice that you want to give to everyday Malaysians when seeking treatment, when looking for healthcare?
Okay, maybe you can clarify more on that. Like, what do you mean by when seeking treatment?
Like sort of like the things that they can pay attention to, rather than straight away going to the ER or whatsoever, understanding their own health, so that it becomes a much more basically, what can Malaysians do in order to help the current situation, not just the government,
Okay.
Yeah.
So this is what you pointed out is quite good. If we are going to, this is actually part of what I want to tell people as well. Like what we said earlier, that most people in Malaysia take healthcare for granted because it's so cheap. Yeah, but essentially, because you are an investing page, most of your listeners are going to be investment related. The biggest investment in your life is going to be your health. That's the only thing that's going to sustain you through. You should put as much investment to your health by understanding your options and knowing about your body a lot better, which a lot of people don't. Yeah. People should pay the same amount of attention as they do towards financial investments as they do towards their health. That's what I want to say. Yeah. Because all is fun, all is fun until the day that you really, really need help, then that's going to be the time where it's going to be difficult. Yeah.
I think
Yeah.
I'll pass the last words to you.
Yep.
Closing our session, right? And while we are waiting questions,
Yep.
as a whole, we let's just tie with a bow, okay? We
Yep.
started off with talking about the medical industry being a sinking ship and all. So, if you could summarize the entire session for the listeners who just joined in, what would it be?
Yeah. Okay. So the medical industry in Malaysia, like I said earlier, I think it's amazing, and I think that because it's amazing, it's something that we have to fight to protect.
Right.
If we don't protect this, what will happen is that our future generations or us in the future is going to suffer the consequences from that. Yeah. Try to not take healthcare for granted. Understand about your health. That's essentially the thing. Push for certain kind of policy reforms. Try to make sure that have a lot more constructive discourse with either the policymakers that the friends that you meet. Have more constructive discourse regarding healthcare. I think that's something which is important, and because your health is yours, you have to take charge of it, right? That's essentially it. Yeah, and one big thing that I would like to stress about is do give Kementerian Kesihatan Malaysia the credit for where it's due. Yes, really, you have to give them credit for where it's due. If you look at the data, KKM actually covers only 30% of people utilize private insurance. 30% of nationals utilize private insurance. So KKM is actually holding up 70% of the bulk of all healthcare in Malaysia.
Wow.
That's a big number. You know what I mean? So give credit to KKM where it's due. You know what I mean? When there are a lot of things that they have done that is probably not even covered by the media. If any social media influencers would like to go and approach KKM or any kind of hospitals to understand more about what they're doing, please feel free to do so. Give them credit for where it's due, because I feel that every day pointing to them and say, oh, this government service is no good, or this is very slow, and etc. etc. This does not motivate them to make it better, maybe. You know what I mean? It's for some people, maybe it does, but maybe let's try a more constructive approach. Yeah, let's do a more constructive approach. Give them credit for where it's due. Thank the doctors that are seeing you in KKM because they are clearly not doing it for money. You know what I mean?
Yeah.
They're getting paid peanuts. Yeah, yeah. So generally, I wish that everybody would like stop blaming each other. Stop blaming each other, and the ultimate goal is a better healthcare system for everybody. Right? We need to engage in like proper discourse and discuss about things of how can we make this process better, rather than just saying that, oh, this doctor is charging too much, this insurance guy is charging too much, this hospital is doing too much. We have to talk about this. So I would like to leave people with questions about that.
Solutions lah. Complaining is fine, but follow up a complaint with something that you hope can be done better.
That's right.
Sort of like a solution to or an alternative lah, so that people can stay more informed and it helps with the situation, right? Rather than just complaining because of complaining.
That's right. Yeah.
So
that is true. Yeah.
That's sound advice. I think everybody should adopt that type of mentality lah. All right, we have one question from Carms, C. Carms. Okay. Any advice on what red flags to look out for when seeking medical advice or visiting a doctor? Concern of some places that might take advantage of patients who are desperate and less aware. Now, do public hospital doctors do that? I'm assuming no, right?
So you can't choose a doctor in the public hospital. I mean, you can't do that. You can't select a particular doctor. In certain places, like if you go to UMMC, then there is a kind of like a private wing where you can actually pay more and select a doctor. But in the general service, you can't. So what I'm thinking about is this question is directed towards the private healthcare service. Regarding of whether the doctor is going to take advantage of you, I think this is something which I can't really. It's basically like looking at a person. You can't really know for sure if you're going to hire an intern or hire a person to your team. You
body
can't
language
know for sure. Yeah, you have to get cues. You know what I mean, of whether this person is trustworthy or not. Unfortunately, there's no easy way to circumvent this. I wouldn't say that all doctors are saints, definitely not. You have to be able to look for a doctor that really cares about you. I think that's very important. And the worst case scenario is you pay the consultation fees, listen to what he has to say, and if you're not happy with it, it's your right to not continue the treatment. Just don't feel pressured to do something if you are not willing to do it. Because I feel that some patients, they go down that route. They feel like the doctor is not like what they like, but still they feel like, oh, because of reviews, many reviews have came to me and said that, oh, okay, this doctor is very good, and then they feel pressured to go down that route. But your body, your choice. Make a proper decision on what you hear, the doctor's mannerisms, and make a decision from there.
Yeah, or better yet, consult a few different doctors, right? To get
yes,
like
you can. Yeah, but it's not very healthy for in the profession to badmouth each other. Like I said, I prefer constructive criticism rather than badmouthing this person. Yeah, you might not know because this doctor might be very poor with interpersonal skills, right? But his surgical skills or his treatment skills is on a different level. There are these people. There are these kind of people. So I wouldn't jump the gun and straight away say, "Oh, this guy can't talk. This guy is just not great." I wouldn't say that. It's a bit more complicated than that.
Right. Yeah, and I think that wraps up our entire session. Really, it's an honor, Dr. John, to have you up here.
Thank you so much. Thank you for having me.
Able to discuss about the healthcare sector. I think the audience really loved it as well. You shared a ton of insights on what's really going on now, okay? And I think the biggest takeaway that I have is that we must be appreciative of what we currently have, right? True. Especially healthcare, public healthcare being extremely affordable, can pretty much consider as free. So we shouldn't take things for granted.
That's right.
And as much as possible, give credit where it's due, especially for those doctors who are putting their passion in their work, right?
Yeah.
and they're not focused at making profits or whatsoever. So thanks again. I'll see
Yeah,
you,
thank
Dr.
you so
John.
much for having
Yeah,
me.
we'll stay
Thank
in
you.
touch.
Thank you.
Goodbye,
All right.
everyone.
Bye-bye.
Bye.
Bye-bye.
Stay safe.
Thank you.